Facebook Live event with the Opioid Alliance. My name is Andrea Magana-Lewis, and I'm your host. And I am joined today by Dr. Cindy Van Keuren, a clinical psychologist and president of the Ohio Psychological Association. Thanks for joining me today, Cindy.
Thank you for having me. I appreciate it.
So the Opioid Alliance is a coalition of business, government, and nonprofit entities from across our state that have come together to end the opioid crisis. And we're so grateful to have OPA as a member of our coalition. Cindy, I'd love for you to just start off by talking a little bit about why the Ohio Psychological Association got involved with the Alliance.
Absolutely. So the Ohio Psychological Association has three major divisions that are driving our primary strategic plan. And the first one is to end the opioid crisis. So we have a lot of resources, we have committees, we have a lot of effort that's being devoted to addressing the opioid crisis from multiple angles, including diversity, underserved populations, pain management, effective pain management, and substance abuse. And so it's a natural fit for us to be involved with the Ohio Opioid Alliance.
Now, since the start of the pandemic, there's been an increase in alcohol and prescription drug consumption, as well as a spike in overdose deaths we're seeing. Now, can you talk a little bit about how COVID has been exacerbating the opioid crisis?
Absolutely, and you're absolutely correct. The American Medical Association has reported an increase in opioid-related deaths in 35 states since the start of the pandemic. So sadly, we are seeing a lot of consequences in the increased use of opioids. And much of it can be attributed to the stress of the pandemic and people just struggling to find their way through this. Many families are experiencing economic crises. They're facing the illnesses and death of loved ones. A lot of marginalized groups have limited access to healthcare or to healthy resources to help them with coping with these stresses. There's been an increase in interpersonal violence within households. And now that people are stuck at home, they're just trying to figure out how to get through this. And alcohol and opioids are often just an effort to try to figure out how to cope with everything. And I do think it's important to mention that we are all vulnerable to a physical response to stress. With the stress of the pandemic, you can expect increase in headaches, back pain, neck pain, insomnia. And for those who were already struggling with chronic pain, they're more vulnerable to exacerbations of that. So again, it makes sense that people are turning to drugs and alcohol just to feel better. And there's also the risk of deconditioning because we are all just less active during the pandemic. And that too can exacerbate chronic pain conditions and other pain conditions that might lead someone to use opioids.
Now, a lot of attention has really been given to how adults are impacted by the pandemic, but we really can't forget that our kids and teens are being impacted too. Can you talk a little bit about how children are being impacted, and maybe what are some signs of concern, that parents and caregivers should be aware of?
Absolutely. So unfortunately, we are seeing higher incidents of interpersonal violence and child abuse in the households. And there's a lot of reasons for that. With virtual learning, children have less access to their support system within the schools. School officials are mandated reporters. They may have their own favorite teacher. They might have someone there that they support, and they just might not be able to have contact with them right now. There's a lot of at-risk children, such as the LGBTQ community, that just don't have access to support systems right now, or at least not in the same way. And there's also just this increasing gap in education. So households with low income have fewer access or less resources related to technology. And so we are seeing this broadening in the gap of learning, and that is certainly adding to the stress for children. So the stress of just being kids is really challenging, but we don't have the same resources in place to protect children. And the kids are looking to the adults in the household to help them manage stress, and a lot of adults are really struggling right now.
That's very true. What are some steps, we as parents and caregivers can take if we believe that our daughter or son is dealing with mental health issues, or if, perhaps we suspect they might be experimenting with drugs or alcohol.
I'd like to share both some preventative and reactive strategies because we all know it's easier to prevent a problem than to try to fix one. So some preventative strategies that all of us can incorporate into our households are just adding some structure, adding some good self-care. Now, when parents are feeling so stressed out and life is feeling overwhelming and chaotic, it can feel like one more thing. But this might help to prevent some of those other problems that a lot of folks are struggling to manage. So adding some healthy family activities like daily exercise can really make a difference. Kids who engage in routine exercise do better in school. They have fewer behavioral problems and they have lower rates of depression and anxiety. You could add in a daily meditation time or mindfulness practice, or again, anything that's just about coping with stress and being a healthy role model as an adult. If we aren't taking care of ourselves, we aren't really showing kids how they might be able to do that for themselves. So anxiety and depression are, of course, risk factors for substance abuse for both adults and children. So the more that we can stay on top of that, the better. Another preventative tip is to limit media exposure for all of us. Stay on top of it enough to be informed so that you can make educated decisions, but don't allow this to kind of consume the majority of your day. It just becomes overwhelming. It's confusing. There's a lot of mixed information out there. So reactive strategies. If you are worried that your child is struggling with depression, anxiety, or perhaps experimenting with drugs, you may notice that the child is becoming more withdrawn, less motivated, less interested in school or friends or other things that used to be important to them. The child might be uncommunicative or angry. They might be more risky, less inhibited than was true for their typical personality. They might be really secretive about their phone use. They might be breaking some of the rules, such as curfew or what the social guidance in terms of mask wearing and so forth when they go out. Teenagers might be experiencing some cash flow problems if they're using their money for drugs. One to watch for is that kids might become a little more clumsy. That might be another sign that perhaps there's something else in their system, or if they're just getting sick a lot. So these can also be signs of other things. It is so important to check in with your healthcare providers, your mental health providers, and just reach out if you're concerned. And I do want to connect you with a couple of great resources out there. The Substance Abuse and Mental Health Services Administration, it's called SAMHSA for short. That is a government-run website. It is a free resource for everyone. They have a lot of resources on how to find help. So if you are concerned about yourself or your loved ones, how you might connect them with services. There are national hotlines, which have been very, very highly used in the last year. There's also information on COVID-19 and related resources. Another resource, drugfree.org, specifically gives a lot of information about children and teenagers, what to watch for and how to be of help to them. And of course, the Ohio Psychological Association and the American Psychological Association both have resources that are available to the general public, not limited to members, where you might look to get some additional guidance.
Awesome, thank you. And you do have social media as well, is that correct, Cindy?
We do. We have Facebook and Instagram as well that you can certainly be part of.
Wonderful. Well, thank you. And I encourage everyone, if you're not already, follow the Ohio Psychological Association on their social pages. And again, please follow us, the Opioid Alliance as well. We're on Facebook, Twitter, and Instagram at Ohio Opioid Education Alliance. So Dr. Van Keuren, I just thank you so much for joining us today for this important discussion. So she mentioned some great resources. We at the Opioid Alliance also have some resources for parents and caregivers at our website, which is don'tliveinDenial.org. And if you have any questions or concerns, if you're listening right now, feel free to post them in the chat below. And we'll be sure to answer them on our next Facebook Live. And also, if you prefer to ask something anonymously, you can also use that. Do that using the contact us button on drugfreeclubs.com. So we will be sure to get to those questions. Thanks again for joining our monthly Facebook Live event. We look forward to connecting with everybody who's joined today in the coming months. And so in the meantime, if you have any topics you'd like us to discuss, just let us know. All right.
And thank you for having me, and thank you for all the work you're doing to address the opioid crisis.
Thanks so much. We're looking forward to partnering with you in the new year.